Public health officials in Kansas are turning to an unusual source to help track the spread of the coronavirus: wastewater. Ariel Rothfield explains why.
It's not a place many people want to be, but it's a gold mine of information for researchers like KU professor Belinda Sturm.
We test what's coming into the plant,
who has been testing wastewater to monitor the spread of the coronavirus in our communities.
But if we can detect the wastewater, we can know what's going up and increasing or decreasing for that population.
Right now, health officials monitor the virus by testing people, but tests are limited and sometimes costly. One reason the Kansas Department of Health and Environment asked Sturm to help.
If we see a positive, then obviously that means within that catchment basin, there are humans shedding COVID, and we're observing them in the wastewater.
The CDC says the virus has been found in feces of patients diagnosed with COVID-19. While studies suggest the virus becomes inactive by the time it gets to a sewer system, it still carries genes that researchers like Sturm can detect.
We are concentrating viruses from 150 milliliters. So with a jar like this, we're seeing what's in there, and we're able to detect thousands of virus particles in that sample.
So far, in her lab, she's tested 12 sites within 5 Kansas counties. Samples from 10 of the 12 facilities tested positive for the virus.
Several of the facilities we sampled, there are no reported cases in those communities. We're finding that the cases are 5 to 10 times underreported. So on one hand, it's not surprising, but it is disappointing.
Suggesting wastewater can tell us a lot about the pandemic.
Experts say wastewater could even serve as an early warning system for future outbreaks. The death toll from the coronavirus in New York City might be worse than originally thought. According to a new CDC report, there were more than 24,000 excess deaths in the city between mid-March and early May. That is the number of additional deaths that experts would typically expect based on this season. Among those, close to 19,000 were either lab confirmed or probable COVID deaths.